We're really humbled to be part of this amazing exercise, which is really life-changing and is going to set us on a new trend for our country. We are honored to be selected. We have already had a busy start on day one. As you've said, we've been allocated 240 doses for this week, and as more stock comes into the country, we will get additional doses. At this stage, we are focusing on healthcare workers as per the first phase, and we are also getting ready to possibly take on members of the public as those phases are released by the Department of Health and the national government. We are very excited to be part of this huge collaboration. We work well with the Department of Health. Even last week we had already started vaccinating as part of a huge project at Petersburg Hospital, and this week is just a continuation as we grow the rollout.
Tell us about the response of the health workers here at these institutions. How have they been reacting to the vaccination?
Healthcare workers have really had a phenomenal response. We've had a good turnout, and we've really had healthcare workers who have embraced this. There are still some who are scared, and we encourage them to read up on the vaccine, but we also encourage them to get the jab. The third wave, we are told, is upon us, and we should find that we are ready and we've been vaccinated before the third wave. Very importantly, we do require healthcare workers to go onto the Department of Health EVDS site and register electronically so that they can get a voucher. Once they have a voucher, it will show that they are eligible for vaccination, and they can visit our site then as soon as they have that voucher, and we'll assist them.
How long is it going to take these institutions to give jab to all the health workers?
So we have already completed over 70% of our healthcare workers over the last 2 weeks. So we should be complete by the end of this week with all healthcare workers who are eligible, and also all healthcare workers who have opted in. Some healthcare workers have the right to opt out. Others cannot take the jab because they are pregnant or breastfeeding and have other health conditions, and they've chosen not to take part in the program.
With the rollout expected to be given to the members of the public as well, how would you say, are you ready as the institution to help members of the public who are willing to come forward and take the jab?
As soon as the National Department of Health announces the next phases, I can commit to you that we are ready. We have contingency plans in place. We have an existing vaccination center, and we've got plans to grow that capability over the course of the next few weeks as soon as the Department of Health releases those. So we really are committed to be part of this program with the Department of Health. This is life-changing, as I've said, and it's definitely what we need to fight against this pandemic, as well as ensure that we keep those basic protocols in place. But the vaccination is just another armor in our fight against the COVID-19 pandemic.
Mr. Brett, thanks for your time.
Thank you very much.
That was the Netcare Pholoso Hospital CEO talking to us about the readiness and the process of vaccinating the health workers at these institutions. These institutions employs about 1,000 health workers. In the province of Limpopo, we're expecting the health authorities to vaccinate about 60,000 people.